You know, the great thing about this kind of roundtable is that the discussion often continues during the breaks and afterwards. And Prola, you'd asked a good question during the break.
Yeah, Matt, I'd ask you if what the insurance companies would have done if the mandate were struck down, but the guaranteed issue portion had survived.
I have to tell you, that was my happy place.
Yeah, I think it's a really interesting question, and many will say that the mandate isn't that strong as it stands. So it's phased in. It starts in 2014. You know, less than $300 if you don't buy health insurance, which might otherwise cost you thousands of dollars per year. Up to, in 2016, it's less than $700 in a penalty, or 2.5% of your income, up to $2,085, I think it is, but it's $2,000 and change. So, I mean, at that point, if you're, first of all, who's making so much that $2,000 is 2.5% and of their income, and they don't have health insurance? Maybe an independent lawyer or accountant or somebody like that. But most people are going to be young, maybe at the early part of their earning career, so they may indeed opt to pay the penalty instead.
Yeah, I mean, the Chief Justice's opinion, he used as a hypothetical, 2016, he projected that the cost would be $400 a month for the premiums for insurance, but the penalty for someone making $35,000 a year would be $60 a month. So it's clearly a better deal for him. For $100,000 a year, it would be $200 a month. So still, it might be a better deal.
There are a lot of reasons why a lot of consumer advocates were not big fans of the individual mandate. First, it's not enough. 10% of drivers in Connecticut, where we have a law, are uninsured. That's about the same number of people who don't have insurance, and that's legal. So a law was never going to be enough. Also, it could actually backfire. I mean, think about this sentence. The government is going to make you buy insurance from an insurance company, or you're going to get a tax. Those three charged words, I mean, can you imagine how that plays? It's not always a good thing to pass a law for people.
And that, for me, tells me why the politics around this is not over with. In fact, again, I think Republicans are going to push hard over the next 4 months to raise money on this issue, and raising those kind of questions that you've raised there. I think, you know, certainly the stakes now for the 2012 presidential election are really high in terms of what could potentially happen in the House, the Senate, and the White House. If Republicans take control of all three, hypothetically speaking, then I think this law comes under attack, and it comes under attack very quickly, and it'll be interesting to see, you know, what the Democrats could do to try to defend this law. I think in the next couple of days, I think the House has said that they're going to actually take a vote to repeal the law, to start that conversation and try to sort of galvanize their base. So I think there's a lot of politics left on this issue that we need to also pay close attention to.
Who do you think it helps the most? Because some people were saying, you know, if it had been overturned, then that would really help the president's re-election efforts. But then some people today were saying, well, it's a big win for the president, and it helps Mitt Romney. And
I mean, it's hard to figure who it helps the most, but I think certainly it helps both sides in particular ways. I think, again, it provides a good rallying point for Republicans, but it also could potentially be a good rallying point for the president to say, here's something, you know, I was at a press conference earlier today among a bunch of healthcare advocates, and one of the things that struck me was someone went up to the poll and said, this, you know, enough with calling this Obamacare, we need to call it Obama Cares. And that gives you the sense that if people can rally around this as being something about helping people who don't have access, about, you know, helping a lot of the folks that that have been helped so far by this, then it could be a rallying point for the president as well.
Does it matter? I'm sorry.
Go ahead.
Does it matter that this is like, that it was actually Romney's base? I mean, they called it Romney Care in Massachusetts. I mean, is it really tough to attack it? And actually, Massachusetts did an amicus brief saying, you got to do this because we try to do it at the state level.
Well, if you watch the press conference today with Romney, it's been hard for him to deal with the issue precisely because it looks a lot like what he did in Massachusetts. And so, you know, the best defense I heard people offer, or which is a weak defense, was that, well, it's okay for a state, but not for the federal government to do this. And I don't think that's a strong argument to make about this.
You know, one thing I have to say is when they were talking about, we did a looking, I'm sure everybody did, on the various scenarios, and the idea of it going down, you know, what's the silver lining? And I think the fact that we had this really tough, very painful political debate, all the town halls, but people are no longer saying things like, you know, the uninsured, you can get coverage and it doesn't cost anything. It's just a little less convenient. I think it's really raised awareness, and people have understood that it costs us all and we're all paying for it. And then there's a collective vision, and so now we're talking about how to do it. So I think we're better off. I think we're way better off because they didn't overturn it, but I think we're better off for the dialogue as well.
Deb, I'm wondering, and this is a question that I've asked you before, but in what ways do you think that already it has helped better health care here in Connecticut?
Well, the federally qualified health centers in Connecticut have already received about $45 million towards expansion of their facilities and building of new facilities. So there's 14 centers across the state. Some are in urban areas, some are in more rural areas. We know that there's medically underserved people all across the state, and the money that's come in so far is going to be used to really expand access. And that's one thing that we know for sure, that with this ruling, there's going to be more demand for health care, and we need actual places for people to go and receive health care. So it's a very positive sign that the federal government got behind the health centers and provided this money for expansion, and people can go and in one location they can get primary care, pediatrics, pharmacy, lab, behavioral health, often dental, all in one place. And that's really due to the money that's come in from this act.
I know we don't have a lot of time left, but I'm sort of curious about what doesn't this law do that you wish it had done?
Oh, we don't have enough time.
That much, okay, okay.
One of the big things is workforce. I think what happened in Massachusetts when they got insurance, people got cards, so they called doctors to try and get appointments, and some of them were waiting in Western Mass, especially for a year to get in to see a primary care doctor. We have a serious shortage that's only going to get worse as we get older, and there's some in there, but not enough.
All right. Well, it's a great discussion. Certainly, we could have a lot more to talk about. We'll have to bring you all back for another part 2. Thanks for being here.
Thank you.
And thanks so much for watching. Don't forget, if you missed something here on The Real Story, you can watch us on YouTube. Thanks so much for joining us, and we'll see you here again next week.